Hi, everybody. I'm back. This is Steve, Steve Main with Fitness for Five. I'm in the health club business here with Dr. Nario of Biointegrative Health Center. Biointegrative Health Center is located in Reno, Nevada. You can look them up online and see what kind of treatments they do. I go there once a week, all kinds of cool treatments for your health and all that. So I recommend looking them up online and seeing what they offer. So, welcome, Doctor.
Hi, Steve. Thank you for the invite again. Thank you for having me.
Okay, so let's talk about smoking. Smoking is something that just fascinates me. You look at like an old Frank Sinatra album, and there's a picture of him and the pack rack, and they all have cigarettes because that was really cool, I guess. And I don't know, maybe they even thought it was healthy. But so we're going to talk a little bit about smoking. So for the purposes of this interview, for that purpose, can you define smoking?
Yes, Steve. So definitions of smoking, so many. And we hear that a lot. And usually this is the sign, cigarette smoking, right? But we always hear this word being used after eating, to relax, to unstress. When the cool kids hang out, they smoke. But what is it really? So smoking, an act of inhaling and exhaling fumes of burning plant material. So what are these plant materials? Examples would be, yes, marijuana, hashish, but commonly more associated with tobacco, as smoke in cigarettes, cigars, and pipes. Tobacco contains nicotine, which is the main constituent, which is an alkaloid, addictive, but both stimulating and tranquilizing substance with psychoactive effects. So as you can see, it works on your brain. But statistics that we have, more than 400,000 people die each year in the US alone due to the past or even current cigarette smoking use that they have. And adult smokers almost lose an average 13 to 15 years of life expectancy from smoking. But despite widespread knowledge of the risks, worldwide prevalence of tobacco use is estimated to be still more than 1 billion. And again, cigarette smoking is considered the most preventable cause of death in developed nations.
Yeah, I guess, I mean, it's some type of an addiction, and I guess nicotine is one of the toughest addictions to overcome. But so smoking is anything, basically what you said, inhaling and exhaling. So it could be, like a cigar, you don't inhale, but I'm assuming you're counting that as smoking. Pipes, I don't know if you inhale that or not, but okay, I think I get the idea of what we're talking about, or what you're talking about as far as smoking. So, okay, let's get into we'll call this the first stupid question that we can just go right by. Is there any benefits of smoking? I mean, maybe of pot or something. I'm assuming that the answer to that is absolutely not. There's not one benefit. So is that true?
That is correct, Steve. The only thing I can tell you, bad effects, unless you consider the good effects, the one that I mentioned a while ago, relaxing and unstressing yourself. But again, we can see this in ads on TV on how the Lung Cancer Foundation actually are using actual patients to be their models. And an example for you would be a lung cancer patient who's on a breathing tube and actually showing everybody what the effects are and what not to be when they continue smoking. So you want to be a model for TV, but not for this one though. But in going into a deeper discussion, how it affects our system, specifically the immune system, it suppresses the immune cells and it increases the susceptibility to infections and certain cancers. In addition, for long-term exposure, it actually promotes a chronic inflammatory process. With that, again, as I mentioned to you, in proneness to infections and even cancers, but for the long-term users, induction of autoimmune conditions where the body's own system reacts to its own, and even architectural or physical remodeling of lungs like permanent damage seen on COPD and emphysema patients. Most of smoking-induced changes are reversible after quitting. The thing is, you have to remember the word that I say is most. And inflammation leftovers still present even in ex-smokers up to 10 to 20 years, even after quitting, unfortunately, suggesting again the low-grade inflammation that is there still persisting in former smokers. But I have to give emphasis again on the immune system that proneness to infection and cancer, especially oral and lung, are the most prominent. And another one that sometimes people don't see are the cardiovascular damages that it can do. High blood pressure increases the risk of strokes and heart attacks, are not completely reversible even when you quit.
Okay, so I guess there wasn't anything good, but is that a list of all the bad effects that smoking can have on you?
Yeah, unfortunately, I tried to find the good ones, but not really falling on that side about the evidences.
Okay, so how about compare smoking to vaping? What's the difference? Because I hear vaping's really bad for you too. It's
Mhm.
an alternative, but what can you tell us about that?
Well, Steve, this is the new age cigarette. You would see this a lot done by the teens mostly. And vaping, again, it was created to be a safer alternative to smoking cigarettes. Is it safer, really? Well, vaping, though, is still harmful, meaning it can still cause lung injury, almost similar to cigarettes. Still, it's inhaling substances other than oxygen into your lungs. And again, the ones who are using vaping has a strong likelihood that they will have future cigarette or tobacco use and addiction. So it's a predisposition or a preemptive picture. And smoking thought to be more harmful because of the product is being burnt and smoke being inhaled into lungs. So cigarette smoking was thought to be like that, but studies had shown similar damage and actually decreased the ability to fight infections from heating up your vaping solutions and inhaling the vapor into your lungs. So just the same, it's not safer at all. So products labeled zero nicotine can have some degree of nicotine in them still, for the reason that no FDA regulation at this time specifically has outlined the contents of what's in what we call e-juice or liquid nicotine.
It's like you're still breathing something into your lungs that your lungs doesn't want. I mean, your
Right.
lungs want air, not
Exactly.
smoke or chemicals, or I don't know, it's just common sense to me. Um, so that answers that. What about chewing tobacco, snuff?
Right.
That's not good either, because that gets, I played college baseball. I used to take a dip once in a while back then, and that stuff will make you high. I mean,
Mm,
you said with the cigarettes, it kind of relaxes you. I'm assuming it's the same.
mhm.
When that nicotine gets in your system, it can buzz you. I mean, until you get used to it. So, what about chewing tobacco?
Mhm. Right. Well, see, that chewing something also was made for the people who wanted to quit smoking. Smokers resort to chewing tobacco to get their regular dose of nicotine. Just give the body a daily dose of nicotine without the act of smoking. Chewing happens across various forms, as you mentioned, snuff. Other forms would be, as they call it, chew, pinch, or even smokeless tobacco. Studies had shown that chewing causes a sudden rise in blood pressure and heart rate. It does not result in lower consumption of nicotine, unfortunately. So the ones who want to stay out from cigarette, this is not the way to go. There is a high risk of oral cancer, a black hairy tongue. Imagine a tongue that you have to comb every day. I'm joking. And bad breath. Good thing we wear masks now for so-called COVID. And to add to the problems, chew or spit, spreading the germs to the people around you. Ew, gross, right?
Yeah, yeah. I guess you wouldn't want to spit with a mask on, right? But
No,
yeah,
not
kind of
good.
a positive of masks. If you got bad breath, put the mask on. That would probably
Yeah,
help.
it's all yours. Keep that breath for yourself.
Okay, so let's say, I mean, look, my opinion, I think kids start in high school, they think it's cool, they get pressured, they start smoking something, and then they go, oops, I'm hooked. So, but as anyone gets old, I don't see anyone saying, you know, I like smoking and I don't want to quit. I mean, deep down inside, they really got to want to quit, right?
Yep.
So, what can you talk about maybe things that you do at the clinic, treatments or something? And I know I think this addiction is such a mental thing, but maybe there's some things that can help, maybe an IV or different medications or whatever. That is there anything out there that I'm assuming nothing's going to be, I'm sure nothing's going to be 100% in helping someone stop smoking. But in your experience and in what you do at the clinic, have you done anything that's worked?
Well, Steve, that's a good question. So there are many alternatives for assistance for smoking cessation, but let's go back to what your doctor, or us doctors usually say. So basically the conventional approaches. So a famous one would be Chantix. So other name for that is varenicline. It displaces the nicotine in the sites of the action in their brain, producing stimulation without nicotine. So efficacy, according to studies, is around 50%. No more effective than simply stopping cold turkey, or no more effective than nicotine replacement therapies. Another one, an antidepressant called bupropion. It works directly on the brain pathways involving the addiction centers. It's very weak, but it suppresses the dopamine reward centers. Again, on studies, 27 to 36%. They quit smoking by week 7 of treatment. Again, very long waiting period and very low percent. Let's go to the famous nicotine patch, gum lozenges. They give you around 23.4% on studies, and they are only best used as supportive with the other medical therapies that I mentioned above. Now let's go to the integrative and alternative ways of cessation for smoking. Hypnosis, very effective, success rate of 66%. But you should really need to go to a qualified hypnotist. Next one would be acupuncture treatments. On studies, they were 514 persons or subjects that went through it, and the success rate was 88%. And that's the thing, as you can see how different they are from the conventional methods that I just mentioned a while ago. But if you really can't stop smoking, so this is what I suggest to my patients. If you're a smoker or even a former smoker, as I told you a while ago, inflammation is still ongoing and lots of oxidative stress is present. So you should be on antioxidants to neutralize these free radicals and from them not to do that much damage in your system. So vitamin A, C, E, B, glutathione, alpha lipoic acid, NAC, it's part of the supplements also that we give to our patients, and also we give them through IV forms. And one thing that I actually have seen good results in is the NAD, nicotinamide adenine dinucleotide IV, though used for anti-aging, but it also regulates the dopamine centers or the neurotransmitters in your brain to lower down addiction. And success has been seen not only by me, but also other practitioners. But again, these are things that us will provide for you in the clinic as we do our assessments on you.
Wow. Very interesting. And it's just, there's so many things that you can do with IV treatments and just knowing what supplements to take. And it's really advancing. So thank you, doctor. That's great information. For anybody out there who's looking to stop smoking or wants information on it, maybe you want to scare your spouse or one of your friends to stop smoking, forward this video to them. So that's Dr. Nario, Biointegrative Health Center in Reno, Nevada. You can look them up online. Thanks for being with us, doctor.
Thank you, Steve. And as we all know, the knowledge is power. And thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.